All right, continuing on with our discussion of the peripheral nervous system, here is a picture of dermatomes, and dermatomes are special areas over the skin that are innervated by a specific spinal nerve. So we can do testing on the outside of the skin to see if there has been damage to specific spinal nerves. So if there's been a spinal cord injury, there'll be changes in sensation over the skin surface. Now, this looks nice and neat, you know, how this mapping of the dermatomes occurs over the body, but it's important to recognize that it's not quite this clear cut. There are some overlapping regions, so requiring some further testing, you know, if we see some changes in sensation. But in general, we can say that, you know, these areas of the skin are innervated by specific spinal nerves. So when we see L2, or that's referring to lumbar L2 spinal nerve coming off the lumbar region of the spinal cord. So again, it just really helps us detect sensation changes and map that to a specific spinal nerve. So dermatomes are very helpful for neurologists. If someone has numbness, you know, over L5 dermatome, then we know that that's L5 of the spinal cord that's been damaged. So it really helps with diagnosing changes in spinal nerve function by looking at the dermatomes. So disorders of the peripheral nervous system, because of some diseases that may occur or damage to nerves, we have specific changes in sensation, and these are some names that you might see out in your clinical, you know, environments. For example, hyperesthesia, we see increased sensitivity to those receptors that are specialized for specific types of stimuli. So we commonly see this with migraine. People who have migraines are sensitive to light and noise, so they would have hyperesthesia to light and noise. Or people with injuries, concussions, brain injuries are also have increased sensitivity to light and noise. Paresthesia refers to changes in sensations such as tingling, prickling, burning. That's specific to nerves, so paresthesia refers to nerve pain. Commonly people have that. You know, when they've got damage or abnormal function, maybe uncontrolled diabetes that has started to damage or affect the blood supply, which also damages nerves. That can cause that tingling, prickling, burning sensation in the skin particularly. I've noticed when I take care of patients with diabetes that their skin is ultra sensitive. So that would be some hyperesthesia with paresthesia as well. Neuralgia just refers to nerve pain as nerves become inflamed. That stimulates nociceptors and causes a painful sensation. This is really hard to control. We don't have a lot of medications that are effective on helping with nerve pain. One medication we do have is called neurotonin, and that is somewhat helpful to people, and some require it in high doses to control that pain of their inflamed nerves. And sciatica is a specific type of nerve pain that affects the sciatic nerve running down the back of the leg. Infections of the nerves, what we see, polio is a type, there's a specific type of polio that can infect the nervous system. Normally polio is an infection of the GI tract coming in through poor sanitation, but only 1%, luckily, of cases will actually infect the nerves and cause paralysis and deformity, and we'll talk about that in just a minute. Shingles or Herpes Zoster is an adult version of the chickenpox. So if a person had chickenpox as a child, that virus lives in the nerve endings and can become reactivated when the immune system is suppressed, which happens often in chemotherapy patients. We see them developing shingles, and also even among young college students with the stress of college and maybe poor nutrition and lots of life changes occurring. College people, women more than men, can develop shingles, which is a painful burning rash over one area of the body, just kind of a patch that develops, and it's very painful. And it is contagious, so you have to be careful, especially pregnant women should be careful around patients with shingles or anybody with active chickenpox, because that can be deadly to the developing fetus. And herpes, we already talked about when we talked about the skin. That's an infection of the nerves around the genital and oral areas, around the mouth. causing, eruptions on the skin surface. And because they're viruses, they stay in the body and can become reactivated and cause infection over and over again. It takes an immunosuppressant medication to keep those viruses from reactivating. So just a brief talk about polio. Polio was a significant disease back in the prior to the mid-1950s. And if you look at some of the data that I have in the notes underneath this slide, you can see that it affected, 60,000 people back in well, take a look here. I have to look myself. I don't remember the specific. Oh, let's see here. We got to go to notes pages. So, let's see, in 1952, 60,000 cases here in the U.S. with 3,000 deaths. So very, very significant disease, but with widespread vaccination, we went on a global vaccination effort, and we have essentially wiped out polio except for a few areas. So 99% of polio has been reduced by this global vaccination effort, and it's given in an oral form. It's cheapest to transmit that way, or transport and maintain, with less, needles and sterility required. So it's just oral drops that's given, the oral polio virus, and been very effective on controlling the virus. But you can see that there's a specific type of polio called paralytic polio, where it leaves the digestive tract and enters the bloodstream and attacks the nerves, causing this paralysis and deformity that we see here. And it also affects the diaphragm. So back in the 1950s, people would lose the ability to breathe well, and they had to go in this long cylindrical metal device called the iron lung, and that would create changes in pressure to allow the diaphragm to contract and relax and allow people to breathe. So they would spend many weeks in this iron lung while they were recovering from polio. So that concludes our discussion of the peripheral nervous system.